studying it, they will tell you to say we need to relate it to the immune system. Now, one of the functions for the lymphatic system is that number one, it prevents what? Edema. Is it edema or edema? Edema. Okay, edema. How? It's very simple. When you look at if these are the arterioles, right? These are arterioles, these are the veins, okay? Then they are joined by the capillaries, okay? So we have maybe the veins, then we have the arteries. Remember, they are going up to the arterioles, right? Arterioles, then the venules. Then we have the capillaries, okay? And capillaries, you'll find that they are all over the what? If these are capillaries, okay, they are capillaries, they are capillaries. Now, we also have in between those capillaries, because the capillaries are the ones that are closer to the what? To the tissues, isn't it? So if we have the cells here, we have the cells, okay, we have numerous number of cells. Now, what we are going to find, anything that is within the blood vessels, we are going to call those as what? The ones that are outside the blood vessels or within these spaces. The spaces, these are the cells, right? Then the fluids that are going to surround this, we are calling as what? Interstitial what? Fluid, isn't it? Okay, they are interstitial fluids. So now, when blood is circulating, it has to be diffused, right? It has to be diffused so that everything can go now to the cells. But now, when there is that diffusion of now the osmotic pressure and everything, because what we need to understand, there are two forces that we need. So there is the force, which we are calling as the hydrostatic force, which is now making sure that the fluids are what? Leaving the what? The blood vessels. And there is also another force, which is the oncotic force, which is now pulling back the what? The fluid. So there should be that exchange of fluid movement, isn't it? Even the cations, in the blood tissues, the blood vessels, the cations, the blood composition, when they are leaving, the hydrostatic pressure is going to what? To allow, because if this is the blood vessel, right? The blood vessels, you're going to find that they have there's pores, right? They have these endothelial pores. Now, when blood is pumped, they are more like bulging, right? And now, if they are more like bulging, which means these pores, the endothelial pores, they are going to increase in what? In structure, isn't it? So that they can allow the fluid to do what? To leave. Now, when they leave, where are they going to go? They are supposed to go into the what? The tissues, right? They are going to go into these tissues. So the blood, the fluid that they will leave, they will go into the tissues. Now, when they leave, you are going to find that this place or these structures, they are going to have a lot of fluids. So now what do we need? We need now another system that will control now the fluids outside the blood vessels. Are we getting it? The fluid leaves the blood vessels, and now when they leave the blood vessels, they are outside the what? The blood vessels. Blood, plasma, everything is what? Outside. What we need from there is that, because if we can leave the fluids outside the blood vessels, they are within those cells, what will happen is that the outside, that's why now we are going to find that the person starts now what? Swelling, isn't it? There is now edema. Now, for us to be in a normal state, for you not to have that kind of edema, what do we need? We need another system. And this system has to do what? To filtrate, okay? To filtrate or to get all the fluids, okay? It has to get all the fluids so that we only have fluids to go back where? Into the blood vessels that can be put back. And some of the fluids that there should be a system that is going to collect now those fluids. And this system is what we are calling as what? The lymphatic system. So it has also all the lymphatic what? Capillaries. So these capillaries now, they are going to start now draining or attracting, okay? So because outside the pressure is not high, the same pressure which is outside, it is going to make that if these are capillaries, they are going to open. And once they open, the fluids will go what? Will do what? Will go into the capillaries. the lymphatic what? Vessels. So that when they enter into the lymphatic vessels, okay, when they enter into the lymphatic vessels, sorry, let me get some. So if we are saying this is the lymphatic vessels, right? Yes. Okay, the capillary. Then we have, they are having some structures like this, okay? Okay, they are having structures like that. Then here we have surrounding cells. Remember, fluids have been filtered, okay? We have the surrounding cells. So the fluids that are outside has to be filtered, has to now join the lymphatic vessel, which are the capillaries, these that you're seeing here, okay? Now, when they go into this, the lymph is not red. Blood is what? Is red, isn't it? Now, what will happen is that when they go into this, or they join, because we have a lot of lymph vessels that are coming from the toes up to where? Up to the neck. The brain and the placenta, we are not going to find that. Even the nodes, the brain, from the brain, we are not going to find the lymph nodes. Now, when everything enters here, what will happen is that the fluids that were outside the blood vessels goes where? Into the lymph vessels, isn't it? So that now, instead of a patient having edema, instead of you having edema, you're not going to have that kind of what? Edema, right? You're not going to have that kind of edema. Why? Because the fluids that were outside the blood vessels have now entered where? The lymphatic what? Vessels, right? And they have to be transported because there is no pump for the lymphatic system. So they have to be transported and they have to join now the supraclavicular what? Artery, so that now they join now into the what? The normal circulation. Now, what we need to understand is that this lymphatic system, okay, it is preventing edema by getting the fluids from there. The next thing that we need to understand is that this blood which is being circulating throughout the body, what is happening is that this blood has a lot of what? Parasites, it has maybe viruses, it has bacteria. Are we together? So now, whatever will go into the lymphatic system, if this blood has a lot of microorganisms, even the lymphatic system will do what? The lymphatic vessel will do what? It is going to have the same blood vessel. So what does it do? So as it is going back to the mid-clavicular, subclavicular artery to join now, what will happen when you look at this structure, okay, what is happening is that if this is the hand, right? This is the hand with a lot of capillary vessels, a lot of capillary vessels for the lymphatic system. Once it reaches the brachial plexus here, okay, once it reaches here, it is going to find something that we are calling as what? The lymph what? The lymph nodes. Now, the lymph nodes, the way they are structured is like this. They have a concave and a convex structure. Okay? So, this is it has more like a bean shaped, okay? Okay. Then it has these sinuses, okay? So this is the cortex, then it has the medulla, okay? Then we are going to have the afferent what? Vessel, okay? Which has the valve here. It has the valve. Another afferent vessel here, which has the valve. We are going to have another afferent vessel with the valve. Another afferent vessel with the valve, okay? Then what we are going to have are these two things, okay? We are going to have the blood vessel, the artery, and what? The vein. Okay, now what is happening here is that remember, we are saying the lymphatic system is not only, there are three major functions, and these three major functions are the ones I want us to understand. We are saying it prevents what? Edema, isn't it? By getting the fluids from the interstitial, it traps that fluid, it starts now saving it, or it starts now sieving. Now, the next thing that we need to understand is that this one is for the immune system. Are we together? So it scans the immune system. It is a scanner. Is it a scanner or scanner? Whatever. It is a scanner, isn't it? So it will scan the immune system. How strong is the immune system for this particular person? So now what will happen is this. Remember, these are capillary what? Vessels, right? The lymphatic capillary vessels. As the lymphatic capillary vessels, if they are coming from the hand, they reaches this brachial plexus, they are going to meet one the lymph node. And the first lymph node it is going to meet is the supratrochlear node. This is the spelling. Supratrochlear node. Now, this is the node. So what happens when it reaches there? It has to be checked. The lymph which is going there needs to be what? To be scanned. We are saying the lymph is colorless, but it is not colorless. There are some fats that are coming from the intestines, because it's one of the functions to extract the fats from the what? The small intestines, and they're the ones that gives the lymph a mucus what? Color. Now, when they reach there, remember it has reached the brachial plexus, and once it reaches the brachial plexus, what is found is that we have the first node, isn't it? The lymph node, which is the supratrochlear what? Node. Now, what is happening here is this. We have, do we remember the macrophages? Macrophages, we remember them, right? Yes. And the dendritic cells, do we remember them? Okay, so we have two white blood cells, because the lymph has high levels of white blood cells, because they are scanning the immune system, isn't it? So if they are scanning the immune system, what do we need? We need high levels of what? The white blood cells. So now, when it enters now from those capillaries, they start now, the lymph has to pass through the what? The lymph nodes, isn't it? And this lymph node, it is now going to scan now. Do you have any microorganism? Now, remember, imagine, it passes, the lymph gets now into these afferent what? Vessels, right? The afferent vessels. It goes into the lymph node. What will happen here is that once it reaches here, the lymph reaches here, we have the macrophages that will just engulf the microorganism. It's more like hugging, eh? It will engulf that microorganism and it destroys it. The other thing, we are going to find that from that blood vessel, from that lymph, because the macrophages are found in the lymph, the macrophages have started the process, isn't it? They have started the process of engulfing the what? The microorganism. The dendritic cells also, okay? If this is the dendritic cell, it traps this microorganism, right? When it traps the microorganism, imagine this is the microorganism, it will just come with it into the what? The cortex. This is the lymph node. So that the lymph node can now scan for that. Now, here what you are going to find are the T lymphocyte and the what? The B lymphocytes. And these B lymphocytes are the ones that are going to deal with this one now. And that's how now the system does what? Scans for all the microorganisms. How? The macrophages will get the microorganism, right? It engulfs it. They will still be moving together. They know where they are taking that microorganism. Where? To the lymph node to be scanned. The dendritic cells, they will trap that one. Where are they taking it? To the lymph node. So now imagine the infection, you have a cut, isn't it? You have a cut here. The microorganism enters the bloodstream. Once it enters the bloodstream, because of the diffusion and everything, the microorganism finds its way into the what? The lymph, isn't it? And once it is going, before the microorganism reaches the heart or reaches any part, it is going to meet the what? The supra what? Trochlear node, isn't it? So that it can be scanned. And once it is scanned, it will be eradicated just from there. It will be killed just from there. So we are finding that the lymphatic system is very cardinal in our body, because it scans for what? For the infection. In case where now they can escape from there, they reaches now the axilla. In the axilla, you're going to find some lymph nodes. No wonder sometimes you feel like when you touch, especially you feel like in the axillary, maybe you have some painful sensation. Then when you touch, you feel something that is like a bump, right? Yes. It means now they are swollen. They are swollen and they are not supposed to be palpable. Are we together? And remember, the lymphatic system has about 600 to 700 lymph nodes. You as a human being. Between 600 and what? But now from that 600 to 700 lymph nodes, only 100 are palpable. Some they are deep. Why should they be deep? Why is it that they are very deep? Remember, what we are saying is, also the internal organs need the what? The lymph nodes. So that they can what? Scan. For the pancreas, you say no, it is infected by this type of microorganism. Then the problem has to start with the lymphatic system. If the immune system is down, we are referring to the lymphatic system that it is not what? Working well. Then the immune system is down. Are we together? Some of the microorganisms probably they can escape. And now when they escape, because they are still in the what? In the circulation. And there is exchange of nutrients, there is exchange of all those things. And remember the lymph also has what? Has the proteins, the ions there, everything is there. Some of the microorganisms escape when they find themselves in the what? In the axillary. We are going to find some lymph nodes there. And we just call them as the axillary lymph node. And what is it going to do? The same process will still continue. Those that escaped, they will be engulfed, isn't it? By the what? The blood vessels, by the macrophages, the dendritic cells. Dendritic cells, they are more like, can I say the shushu? Like those people who reports everything, eh? Mm-hmm. And that's how they work. They just report, they will just come out. No, I've come with a Staphylococcus aureus. And the B and T lymphocyte, what are they going to do? They will just engulf that one and kill that microorganism. They escape from the Bragg plexus, they find themselves in the axilla. What is going to happen? The same process will continue. Now, what you need to understand is this. Where are we going to get the macrophages? Where are we going to get some of these? Number one, we have these. So every lymph node, those lymph nodes, because they are very small, about 20 millimeters, something like the structure. Every lymph node has what? The artery and what? The vein. It needs to be fed, isn't it? The same will carry also the what? The white blood cells. They will feed this one with the what? So the B lymphocytes are migrating from where? From here. Are we together? So that they can be there. When they are there, they are the ones who are going to finish now everything. So we are saying, you can have a cut from here, isn't it? You can have the cut. Once it reaches, this is the knee, isn't it? Behind the knee, we have the popliteal what? Lymph node. And that popliteal lymph node is going to do the same business. Hello? It is going to do the same business. It is going, the dendritic cells, the macrophages will report now to the cortex aspect of the what? The lymph node. And tell now the B lymphocytes, communicate with the B lymphocytes to do what? To do everything. Imagine they escape. They come here. We are going to find the what? The inguinal what? Lymph nodes. And these inguinal lymph nodes, what are they going to do? The same thing. So we are saying, apart from preventing edema, they also scan for what? Infection. It's very important, a very important system. A very, very important system. The last one which we can talk about is having absorbing fats. Okay, it absorbs fats from the intestines. So when it absorbs the fats, because the fat cannot only be absorbed anyhow. So we need now those fats to go into the what? The lymphatic system. Once it goes there, it's the one now which is going to give that mucish color to this now lymph. So now the lymph that we are seeing is very important, just like the blood itself is what? Important. But for us to extract that lymph, we are extracting it from where? The blood plasma. Because we know that the blood plasma is the liquid part of what? Blood. So once it goes there, in the capillaries, as long as there is a hydrostatic pressure, the oncotic pressure is balancing, the fluids will leave. When they go in between the cells, we are finding a lot of the lymph vessels, the capillaries, a lot of them, and those they are going to start now attracting those fluids, okay? Attracting, and they will be colorless. The fluid which will be there will be colorless. But as it is passing, it passes now, because all these, we are seeing all the capillaries, they are going to meet at a certain point, okay? When they meet the cisterna calli, okay? The cisterna calli is the one now which will go to the thoracic trunk and now joins the what is the supraclavicle artery, and it is going back where? Into the bloodstream. And everything, that's how it goes now. So it's very important. Now, you're going to find that this is the patient who has come with swollen tonsils, right? The tonsils are swollen, and that's the commonest condition that we may talk about. Because we are saying tonsillitis is caused by what? The beta hemolytic streptococcus, isn't it? It is coming from the streptococcal group, which is now the group A beta hemolytic streptococcus, isn't it? So now, if it is in the stream, in the bloodstream, okay, it enters the what, and the immune system is down. What will happen is that it is going to inflame the what, the tonsils. And when you palpate, you will find the person is what, having tonsils that are what. Everyone has tonsils, right? Everyone has tonsils. And now, since everyone has tonsils, what are we saying? If everyone has tonsils, tonsils are part and parcel of the lymphatic system. Now, if they are part and parcel of the lymphatic system, we are saying tonsils improves the what? The immune system. That is the reason why when a person has tonsils, what will be the complication number one? That's why you're going to find a person is suffering from what? Rheumatic fever. Are we together? Rheumatic heart disease, they are coming from those. Okay? The person can even have start because the immune system is down. And if the immune system is down, it means the lymphatic system is what? Compromised. And we don't want that. No wonder they will encourage you to eat well, exercise, so that everything is moving smoothly. Now, having said that, we need to understand, where do we find these lymph nodes? Do we know that the whole body, we have the lymph nodes, eh? Where you are not going to find the lymph nodes? Probably the brain, because they will tell you to say, you are not going to find the lymph nodes there. Even in the placenta, you are not going to find the lymph nodes. But starting from the occipital here, up, down there, you are going to find. Those that are palpable, we call them as these superficial lymph nodes. Because you're able to palpate them. They are very close. They what? To the skin. So you are able to palpate. Now, if you are able to palpate the lymph node, then it means that lymph node is what? Inflamed. Are we together? If you are able to palpate the lymph node, then it means it is what? Inflamed. Lymph nodes are not supposed to be palpable. Now, there are other organs that are within the system, okay? So, for example, we can talk about the thymus, right? The thymus. Have you ever heard of the thymus? The thymus is found in the thoracic cage, okay? It is nearer to the heart. And the thymus, during early life, it is big, so that it can continue producing the B lymphocyte and the T lymphocytes, which are part and parcel of the immune system. When you start aging, at your age, right now, at your age, switch on that fan, please. It's okay? There's no power. Okay. So, at your age, it starts now reducing, and actually, studies shows that it reduces by 10th, okay? 10 times the way it was. So it becomes, and to some they say it has no use in adulthood because it has produced. And we also have another organ, which is the spleen, okay? The spleen, we know the spleen, which is just nearer to the what? The stomach and the liver. The spleen, it is very important because when red blood cells reaches the lifespan of red blood cells is 120, isn't it? So when they die, what happens? Where do you think the red blood cells will go? They have to be what? Excreted. They have to be denatured, isn't it? So now we need the spleen now. So this spleen, it is going to trap those what? So the red blood cells that are dead, the old ones, they go to where? The spleen. The spleen, they are going to find a lot of macrophages. They will engulf because the body knows that they are supposed to die by the process of what? The natural death of cells is called what? Apoptosis, isn't it? So they are supposed to die by apoptosis, isn't it? Now, when they die, they have to be regenerated. More like it is useful because it is genetically programmed. Okay, so the spleen, what the spleen is going to do is to start now separating and demarcating the iron, all the elements. They should go back to the what? To the body, isn't it? So that we can have iron, and that's why now even the bilirubin is what? Coming from. Are we together? Bilirubin, which is being produced there, it is insoluble, but it has to be turned into the soluble once it passes through the liver, and it will be stored where? Where is it going to be stored? In the gallbladder, isn't it? And once it is stored there, now it is formed from bilirubin after a lot of biochemical reactions. We have the extract of what? Bile. And this bile is going to be stored in the gallbladder, and once it is stored there, we are going to use this bile for the what? Emulsification of what? Fats, which is physical digestion of what? Fats. Now, when it is emulsified, it is coming as a result of what? Bile. Where is the bile coming from? From the what? The red blood cells, isn't it? Because of the bilirubin breaking down, it is converted into bile. From bile, now we have the bile being used to emulsify the fats, and some of the bile are the ones that are now going to be what? Part and parcel of the stool, and that is what is giving out the stool color. If it is yellow, to be yellow, though it can be affected by the diet. Are we together? That is the spleen. Very, very important. Red blood cells will not be denatured if we don't have that. The other organ that we need to understand also is the bone. You know that the bone also produces white blood cells, right? Because of the stem, isn't it? So it will produce white blood cells, and these white blood cells are part and parcel of the what? The lymphatic system. Is lymphatic system becoming easy to understand? Okay, so that is what we can say now about the lymphatic system. Now, where do we find this prominent? Okay, in most cases, when you go to the clinic, they have specific places. The time we were doing the examination of the integumentary system, we talked about the what? The lymph nodes. Now, I understand we never understood them because we have this examination and we need to understand them properly. Okay, so now we are saying from here, just behind the knee, okay, just behind the knee here, the posterior aspect, you're going to find the popliteal what? Lymph node. Okay, you're going to find the popliteal lymph node. When it travels, the vessels come to the inguinal area. We are going to find the deep inguinal lymph nodes. Now, when we say deep inguinal lymph nodes, it means we cannot palpate them. They are deep because we have organs and tissues that are deep, isn't it, in the body, and those are the ones where now, in case where we have those lymph nodes that are deep, okay, that are very deep, they are going to attack the microorganisms that are affecting the body, isn't it? So we have also the superficial inguinal lymph node, because this is what? The inguinal area. So we are going to find, and you can still palpate them. You can still palpate them. If they are inflamed, then they are palpable, then there is a problem, okay? Now, when we come to the abdomen, no wonder we are seeing, we have the what? The intestines, the stomach, the pancreas, the spleen, the biliary tract. Do you know that they have a lot of lymph nodes there? This stomach, you are going to find a lot of lymph nodes, okay? When you go to the small intestines, you are going to find the lymph nodes. And why is the small intestines part and parcel of this? The fats. We said we need what? The fats. Are we together? And those fats are the ones that are going to give the mucus structure or the mucus color of the what? The lymph, okay? We also need, from there, we have a lot. So the deep inguinal nodes, we also have the superior inguinal node, then we have the superficial inguinal nodes. When we go to these aspects, you are going to find the pre-aortic lymph nodes, because the aorta, the way the aorta is moving, it has to have what? So now what we need to understand, whenever you see the blood vessel, whenever you see all the blood vessels, also the lymphatic vessels are supposed to be there. The reason, because we need to scan, isn't it? We need to extract the fluids. Are we together? So whenever you see, every part you are going to see the blood vessels, remember they are going to be what? The lymph vessels. So they go in pairs. You cut the blood vessel, you are also cutting the lymph vessels. Are we together? Okay. So when you go, this abdomen, the abdominal lymph nodes, there are a lot. There are a lot. That's why you're going to find now also the pre-aortic, the aortic lymph nodes. Now, when you go to the axilla, you're going to find the axillary lymph nodes. When you go to the neck, okay? Now, the neck, when you find, we know the clavicle bone, isn't it? Mid-clavicular aspect where you're going to find the sternocleidomastoid muscle, this part, okay? You're going to find that along this muscle, when you touch here, along this muscle, you're going to find a lot of lymph nodes. Are we together? Even the other side, because there is the jugular vein there, okay? When you go to the occipital here, occipital, you're going to find lymph nodes. Are we together? There are lymph nodes here. When you come to the, can we also touch here? Just behind the mastoid bone, there are lymph nodes that are not palpable. You don't have to feel the lymph nodes there, but you have them, okay? Then when you, after this, just here, sometimes when you touch it, you even feel like you are almost, if you can press that much, you will feel here, just here, where we are going to find the mandible, is it the temporal mandible joint? Yes. When you place there, you feel uncomfortable. Yes, you will feel uncomfortable now, me please. Then you're not touching the place. So here you're going to find the lymph nodes. Just at the joint here, the mandible joint here, the jaw joint here, you're going to find the lymph nodes. Between the mandible joint here, halfway here, you're going to find the lymph nodes, and you're going to give them the names. Here you're going to find the lymph nodes. When you come here, you're going to find the lymph nodes. Up to here, you're going to find the lymph nodes. These lymph nodes are the ones that you can palpate. Do you know that the lymph nodes that are near to the pancreas, you cannot palpate them? Why? Because they are very deep. Lymph nodes are very, very small. This structure you're seeing here is not how they are. They are very, very small. They are not even close to a centimeter, the size. They are very small. But if you are able to feel the lymph nodes, then there is a problem. Okay, can we start? So now this is the patient. So we are saying, from here we have the popliteal, okay? From here we have the popliteal, we have the inguinal, okay? The deep and the superficial. The superficial are the ones you can feel. On the abdomen we have the abdominal lymph nodes, okay? The pre-aortic, the aortic, all those. Then that's why now they are. So from the abdomen we are going to meet, okay? The lymphatic vessels, they are going to meet, and now where they are going to meet is what we are calling as the cisterna calli, or the cisterna chili. So when they meet, they are going to the mid-clavicular artery here, so that they can now join the system. Now, when you come to the hand, from here there are no lymph nodes, okay? But when you reach here, you're going to find the supratrochlear nerve. So the supratrochlear is here, okay? Just inside here, that's why you're going to find the supratrochlear. When you go to the axilla, you're going to find the axillary lymph nodes. You come here, you're going to find the lymph nodes. Now, I would love the patient to sit on that one so that we can now illustrate how we need to palpate. So here, so here we are saying there are only two things, right? You can only inspect if you see something that is inflamed, right? When you open the mouth, where you are seeing the uvula, the Lord, do you know where the uvula is? Okay, where you are seeing the uvula, just beneath there when you are seeing the uvula, that's where you are going to find the tonsils, right? But do you know that the tonsils, when they're inflamed, they are going to be palpable. So you find that the placing down, because of the tonsils, you will still palpate them here. That's why the tonsils and the parotid, they are going to be palpable from this aspect. Are we together? So initially, when you're doing this examination, number one, we are saying, if you are doing examination of any system, regardless of you doing history taking on all the systems, right? Like the general history taking, each system should have its own history taking. Are we together? This is the lymphatic system, okay? This is the lymphatic system, and if you're dealing with the lymphatic system, the history taking you're going to get from this particular patient should be different from the history you're going to get from the person with any issues to do with the integumentary system. Why? Because what the patient will present might be different from what another patient will present with a different condition. And we also need to appreciate that all these systems, when they are affected, the skin is always what? Affected. Are we together? The skin is always affected. Imagine you are palpating, then you feel a mass here. Automatically you are going to write, if you are dealing with the skin, you are going to say there are what? I'm feeling some what? Some nodes that are inflamed. Okay? So now, when you come to this particular patient, he should be in the hospital gown. Why? Because we need to expose the inguinal area, but we need to maintain the privacy. But we need to do what? To make sure that we need to palpate the inguinal. You cannot examine the patient while they are dressed in their clothes. Even if you are dealing with the respiratory system, you still make sure that the shirt is what? Out of their body, isn't it? You're dealing with the intermediate system, you are going to put them what? In the hospital gown. So even this particular patient is supposed to be put in the what? The hospital gown. Are we together? You are going to do the hand hygiene. Okay? The hand hygiene. From there, you are going to don in gloves, right? Okay? Let's get some gloves. You need to don in gloves, right? Because most of the things that are occurring on this particular patient, we are just palpating. You know, we are just watching, palpating. Now, since we are palpating, we need to don in what? Gloves. Remember, even when you are inspecting, if you want to can don in gloves, just then, but don't start confusing yourself when you are palpating, when you are inspecting, you are doing what? Inspecting. Are we together? So now we come to this particular patient, isn't it? So I need to get permission. If you have the ward, I'm supposed to get the permission from the ward in charge.
Just a moment.
Okay. The ward in charge.
I can stand there.
So I'm going to get the permission. Then I come to the patient, isn't it? I need to get that biography. Are we together? And the way you're going to position yourself, don't position yourself behind the patient, then you're talking. Now you're expecting the patient to be turning the head. What if the patient has tonsillitis? Do you think the patient will turn the head? No. Everything will be so painful there, right? Even when they just have the distended jugular vein, everything will be so painful there, isn't it? So you need to face the patient, isn't it? Okay? So I come to this particular patient. Good afternoon, sir.
Good afternoon.
So, Mr. Mwenya, one of the clinical nurses at Rusangu University Clinic, and I've been assigned to examine some of your body parts. So we are just examining the lymphatic system, which is where we want to see why you are presenting with some of the signs and symptoms, which is making us to tell that maybe the immune system is down. So this one is going to help us to come up with a proper diagnosis. Okay? So is it okay that I can go ahead with the procedure?
Go ahead.
The other thing that I would just love to ask is I need to get maybe your name so that I know the person you're talking with.
I'm going to carry.
Okay, so which name do you prefer me to use?
Wenge.
Okay, so I'll be referring you to Mr. Wenge, isn't it?
Yes, sir.
Okay, is there anything that I can do within the premises here?
No, not really.
All right. So at this point, when I get the consent, the patient has consented me to say I need to go ahead, isn't it? So the biograph that I'm going to get, I'm going to ask the name I've gotten, isn't it? The age, hello, the age. Do you know that some of the conditions they go with age? You know that pediatrics suffer from tonsillitis compared to what? Adults, isn't it? Okay. Then the other thing that I'm going to ask is where they are coming from. Okay. All that biography, okay, where they're coming from, the church they go to, and the occupation. Then we go to the social aspect. What do they do in their free time, right? Yes. So social aspect, I'm going to ask if the patient does what? Smoke. If the patient does what? Drink, isn't it? Or they take alcohol. Do they smoke? Do they take alcohol? What other hobbies do they do? Then when I come now to the past medical history, okay? Past medical history, I need to ask you questions in relation to what? The lymphatic system, because we are doing with what? The lymphatic system. So what am I going to ask? Number one, I'm going to ask if they are allergic to anything. Maybe that's the reason why they are swollen, right? Maybe they ate something, then they are allergic to that. Is there any medical, maybe they have anything to do with maybe complications of the mouth, right? Any complications of the mouth will lead to what? To tonsillitis, can lead to tonsillitis. If they have pharyngitis, do you know that pharyngitis can also affect the what? The tonsils, isn't it? Even the paradigm tonsils, they can also affect those. Okay, so I'm going to ask about their past medical history. If they have now, we can also come to the hypertension, right? They have hypertension, maybe they're asthmatic, okay, tuberculosis, because if there is any compromised condition that will lead now to the swelling of the lymph nodes. Are we together? From there, I'm going to ask if they have any surgery. Do you know that if we give an example of tonsils, when you have recurrent tonsillitis, when you have recurrent tonsillitis, they can even take you forward. They can remove the tonsils, which is tonsillectomy, isn't it? So I should ask if they have gone for any surgery regarding the what? Their body, isn't it? Then they tell no, maybe sometimes back I went for what? They had to get rid of one tonsil now, the other side where they did not work on it, okay? They are giving me that information. We go to the family history. We get that family history. After that pharmacological aspect, what are they taking? Did you take any medication as you were coming? Because maybe you are feeling pain and you wanted to take some medication. Are they taking on it? Are they, maybe they are on any medication, right? Like maybe for hypertension or HIV or any, okay, which could be chronic or not chronic, isn't it? The other thing then, we need to go to what? To the presenting what? What now has brought them, isn't it? What has brought this particular patient to your facility? And now when they tell you, because you as a clinical nurse, the patient tells you to say, I am feeling there's a lot of pain from here, right? A lot of pain from here. That is now the presenting what? Complaint, isn't it? And that presenting complaint will lead you now to do what? So now, having collected that information, the history from that particular patient, what are we going to do now? At this particular time, we need now to do what? To examine the patient. So you tell the patient to say, we are going to put you in what? The hospital gown. Then at some point, I will request you to do what? To be on the bed. But when they are on the bed, you need to put them in a supine what? Position. You can either put them in supine position or you can put them in what? Semi-recumbent. Is it semi-recumbent? Is it semi-recumbent? Same Fowler's position, right? Yes, the position where they feel comfortable, right? Because in some instances, if you find that they are so inflamed, they are swollen, even the breathing changes, isn't it? So now you tell the patient, we'll put you in a gown so that we can examine you, okay? But we'll maintain the privacy, okay? Now, let's start from this. So you turn, right? You tell the patient to say, I will start. So you just tilt the head like this. Then you start palpating from the what? The occiput, okay? You are starting from the what? The occipital. You cannot palpate the head for the lymph nodes, please, okay? Let's go to the what? Occiput. That's why we are starting from. So now I am going, this procedure can even take you 5 minutes. Within 5 minutes you are done. Even in OSCE, 5 minutes you are done. Trust me, you can get the history in 2 minutes. The next 2 minutes you are palpating. The last minute you are giving IEC. You are done. Simple, right? So you start from here. So the occipital, so I will tell the patient to say, I will palpate, I will start from here, because these are running commentary procedures, eh? So I cannot feel the lymph nodes, because this is the cervical aspect, right? We remember the spinal cord? We are starting with the cervical, isn't it? Up to the what? The coccyx, isn't it? So from the cervical. So now from the cervical, we are starting with what? The occipital, right? So I find that there is nothing, okay? I cannot feel any mass from there. So the patient is okay, right? No swollen lymph nodes on the what? Occipital, okay? So I tilt the patient like this. I'll come where? Here now. When I come here, I need now to face the patient, right? But you need to be conscious, okay? You are a man, isn't it? You are a man. You tell the patient to open the leg like this. Then, this is the female patient, eh? We need to be professional, isn't it? It's either maybe you are a woman, maybe this is the male patient. You as a lady, you are the one. Then you come closer to the patient. What are you trying to do? Eh? What are you trying to do? If you know that you cannot position yourself like this, because you bend like this. What will happen now to your chest? Okay? So that's why now we need to maintain some distances with what? The patient, isn't it? So now I will come, I'm still this side, okay? I feel on the what? The mastoid, okay? Can we all feel the mastoid? Can we go to the mastoid bone? Anyone to tell me what they are feeling? Are you feeling any small lump? This? There's nothing. Where's Madoro? Madoro, are you getting something? Madoro. Are you getting something from there? So now, when we come here, on the mastoid, the lymph nodes that are on the mastoid, I cannot feel what? Anything, right? What do? I go to this part. Are we together? Just beneath here, where there is this mass, okay? Now, I'll just palpate. There's nothing like any, because that's why now we are going to feel even the parotid. Are we together? The parotid. Then, from here, I cannot feel anything, right? Now, at this point, I can turn, because now I'm coming to the what? To the jaw, isn't it? So now, I started with the mastoid, right? So now, on the mastoid, there is nothing, and the ones that are found on the mastoid, we are calling as the what? The post-ocular, the post-auricular lymph nodes. So, the post-auricular lymph nodes are not palpable, so the patient is okay. The next thing I come is here, okay? I touch here, okay? Here we are going to find the anterior what? Auricular what? Lymph nodes. Here we have the posterior, the anterior auricular what? Lymph nodes. So here I cannot. So when you're palpating, you're not palpating like this. You are palpating like this, right? So I cannot feel anything. The next thing I'll go now where just beneath the ears, okay, to check if the parotid are palpable. So I cannot feel any parotid which is palpable. Those are the normalities. If I can feel any abnormality, I need to record, okay? I come now to this jaw, okay, so that I can feel now for the tonsils, okay? So now we come here, the tonsils, the lymph nodes here, they are not palpable, right? Then halfway here, you turn the patient like this, halfway. So if you find that it is difficult for you, you can turn, okay? You come here, isn't it? Okay? Now, you tell the patient, I cannot feel anything here, isn't it? So which one are we started with? The post-auricular lymph nodes, the anterior auricular lymph nodes. We come to the tonsils, right? There is nothing, the parotid, there is nothing there. We come to the tonsils here, you palpate, okay? Now, here there is a jugular, right? There is a jugular and there is a carotid. So when you are palpating here, because you may press on the what? The carotid for long, and now you find the patient is not, the patient is not breathing, right? So when you are palpating this side, you release this hand, right? You palpate this side, you cannot feel the tonsils, the inflamed tonsils. You come this side, you cannot. So on both hands, both sides, you are checking. It's a bilateral, isn't it? You go to the submandibular lymph nodes, okay? Just between here, between this side, okay? Just after the joint, here we have the submandibular lymph nodes. I cannot feel. When you are palpating, you are going up to at least a centimeter, okay? I cannot feel anything. What do? I go to the what? Submental. Submental, I cannot get anything. Where the submental is, it is just nearer to the sublingual, okay? So sublingual, the submandibular glands, the sublingual glands, and the parotid glands, all those, they secrete what? Saliva. Are we together? So we are done with this part. What do? I go to the mid-clavicular, isn't it? Then I come direct. What am I getting from here? I'm getting the lymph nodes that are along the what? The jugular. Are we together? So I am palpating, going down there. I cannot feel anything. I cannot feel anything. Which means the head and the neck, the lymph nodes on the head and the neck, they are not palpable. And the patient is what? Okay, but in case the patient says, I'm feeling pain here, then you are going to concentrate on the what? The tonsils. Are we together? When you are done, the patient is in the sitting position. What do? You tell the patient to do what? To be on the bed. Are we together? Yes. So can we have the patient to be on the bed? So Mr. Wembia will put you on the bed, but you'll be in this position so that we can just palpate. Okay, so now You need to position yourself right there. So now, as you are palpating now the axillary lymph node, you need to put the hand of the patient like this, isn't it? Then you start palpating. So it's posteriorly to anterior, then you go to the middle part. Okay, so now I'm going to support like that. Even if the patient is seated there, you can still support them. Right? So you start from the what? The posterior, isn't it? Because that's where the axilla, this whole part is what? The axilla. So you start from the posterior, okay? So remember, the patient is in the gown. You expose the part you are palpating, isn't it? So you start with what? The posterior axillary lymph node. There is nothing there. You come to the axilla, the anterior axilla, there is nothing there, right? Now you go into the original axilla. I don't know, you call them the armpits, right? Don't make the patient to laugh, right? You're just palpating there. If there are some lymph nodes, are we together? When you're done with this part, you turn, you go to the what? The other side, isn't it? You support like that, you check posteriorly, anteriorly, then you go into the what? The axilla. They are lymph nodes. The lymph nodes that we're palpating, they are superficial lymph nodes, so they are closer to the skin. When you are done, you go to the what? To the arm, isn't it? You go to the brachial plexus here. So now, here, it's here, okay? Are you able to... Okay. So we are checking them from here. We are checking from here. The supra what? Trochlea, isn't it? So from here, I feel that there is nothing, right? There is nothing. I'll go to the nati, to the other hand. I'll tell myself when the palpate from there. The next thing that we are going to do is to put now this particular patient in what? The supine position, right? So that we can expose and get the consent, because now you are going into the private part of the patient. Eh? So you get the permission on that part. So that you can now palpate in the what? Inguinal. So the inguinal lymph nodes, we only palpate the inguinal lymph nodes that are on top, isn't it? So you're going to start from here going down, okay? So now when you're palpating, you need to position the patient's leg like this. Hello? Then you palpate with respect to the patient, please. Because what we want to feel is what? The inguinal region, isn't it? When you're done with the inguinal region, the last part you're going to palpate is to go to the what? Popliteal. Okay, so the popliteal you are going to palpate. I cannot feel anything. You go there, you cannot feel anything. And that's how we can palpate. So on this particular patient, if there are no abnormalities, we only palpate. But if there are some abnormalities, you can even inspect. If maybe here it's swollen, you can inspect that it is swollen. Are we together? So this is how you can do. So the last thing you're going to do is the post-procedure steps, where you thank the patient, you tell them their findings to say, we haven't found anything, or if we have found, okay, the lymph nodes here, they are what? So now we need to collect some blood so that we can take now for full blood count and get other investigations. Are we together? And that's how you can collect, isn't it? This is how we can collect the objective data on this particular patient.